Hello, I'm Dr. Arnold Breitbart. I'm a board-certified plastic surgeon, certified by the American Board of Plastic Surgery. I'm medical director of the Gynecomastia Center of Long Island, with offices in both Manhasset, Long Island, as well as in Manhattan, New York City on Park Avenue. I treat patients with gynecomastia, or enlarged male breast, from all over the United States and all over the world. There are many causes of gynecomastia. Typically, gynecomastia develops during puberty and doesn't resolve. I treat patients from teenage years to guys in their 70s, so they present at all ages. Many patients that come, later in life, after the surgery, say, "Oh, I should have had this, a long time ago," but they're happy they eventually, got it. Patients, during puberty could develop an enlarged, breast tissue. Sometimes this goes away, but when it doesn't, it persists and presents as gynecomastia. There's not necessarily identifiable reasons why this happens. Sometimes it could be hormone related or hormone imbalance. Oftentimes there's no specific reason or measurable hormone imbalance. Sometimes it's hereditary. Sometimes it's related to medications such as steroid use. It can be related to marijuana use even. Sometimes it's related to the use of anabolic steroids for muscle building, and I've had patients that even just used it briefly and developed gynecomastia that didn't go away. But the good news is there's a great effective operation to take care of gynecomastia. This is one of the operations I do the very most of. I do several of them a week. The operation is an outpatient surgery, where the patients go home the same day. The recovery is very quick. Most guys are back in school or work, within a couple days. Obviously, they need to avoid strenuous upper body physical activity for a few weeks, but regular activity is fine. The patients typically, in my experience, the way I do the surgery, have very little to no pain, afterwards, and typically when they come to see me in the office the next day, tell me they took no pain medicine at all, and usually not even Tylenol. And even the first day, they're already looking, great. It's a life-changing, surgery, for my patients. And whereas before the surgery, they were embarrassed, self-conscious, wouldn't take off their shirts, at the pool or the gym or the beach, embarrassed in their t-shirts even, and afterwards, just feeling confident and looking good with a normal, male chest, proud to show off their, new chest at the pool or the beach or the locker room, looking good in t-shirts. I've had many patients send me pictures of them even after the surgery, at the beach or the pool, showing off their, excellent contour of the chest and telling me this is the first time they've ever been able to, go to the pool or the beach and take off the shirt and feel good about themselves. So this is an operation with very high patient satisfaction, and justifiably so, because it's an operation where the patient looks great, feels great, and hardly has any scar, or often even no scar that you can see afterwards.